On-the-scene video coverage of AHA 2012 is supported by Pradaxa.
I think it's always reassuring if the FDA has done an adequate post-marketing surveillance study to determine that there's no measurable increased risk of bleeding with Dabigatran compared with warfarin. But it's not clear that that's necessarily going to impact practice. I think the most important things are for cardiologists to review the specific indications for Dabigatran, which are still limited to stroke prevention in patients with non-valvular atrial fibrillation. I think it's reasonable that there's some concern about the use of Dabigatran for off-label indications. And then secondly, to review the specifics about what might make Dabigatran safe or less safe in any individual patient. And thirdly, this is generally an elective decision that's made between physicians and patients. And we have to be very respectful of patient values and preferences in making a decision together as to whether they wish to use Dabigatran or an alternative anticoagulant versus warfarin. And I think it's prudent usually to give the patient and the family adequate time to come to a decision as to what the better strategy would be for them, and to make this decision in concert using those principles. I think that it's also very important to share with patients and families that there remains no antidote for the correction of the effect of Dabigatran or alternative anticoagulants in the case of serious bleeding, and patients need to factor that into their decision making. So this is a decision that really has to be made together, and I think it's worth emphasizing that.